In this presentation, we'll talk about the guidelines to resistance training. Resistance training or strength training is an excellent way to improve your heart health. With a combination of aerobic exercises, resistance training, and flexibility, along with even good proper nutrition habits, we've managed to reverse heart disease, lower your blood pressure, reduce cholesterol, improve blood sugar, improve your body composition, lower stress, and increase your energy. But in no way is resistance training to replace your aerobic exercises. Resistance training is interchangeable with strength training or even weight training. Basically, it is using your muscles against a force that causes a gain in strength, endurance, and or mass. So there are many benefits to resistance training. Many people feel that, I really don't want to get bigger. Well, it's not about that. It is about increasing your strength so that you can perform activities of daily living with much more ease, perform sports such as golf or tennis with much more ease, or just even generally increasing your fitness. You don't have to get big. Resistance training improves your strength and endurance. It strengthens your skeletal system and limits atrophy, which is where your muscles decrease in size, and that naturally occurs as you age. So you can prevent that with having a good resistance training program. It can help improve your fitness level. It can help use oxygen much more easier. It can help with your body composition, with weight loss. It changes your fat-free mass, which increases your muscle, therefore helps reduce fat as it is easier to burn. It can decrease body fat, as will the energy that is required by your body even at rest. This also increases the energy needed by your body during activities. So the more muscle, the more energy is needed to be broken down to supply your body to function properly. And this translates into more fat calories and fat being burned each minute. After you perform resistance training, your body needs to rebuild the muscles to get stronger. And this uses more energy, and this increases your metabolism just like aerobic exercise. And it's great for losing fat. Resistance training can improve your bone density and decrease the likelihood of osteoporosis. It is one physical activity that you can put enough stress on the bones to stimulate remodeling and increase bone density. It can help also improve your cholesterol profile or your lipid profile. And studies have shown that we can reduce your triglycerides or LDL with resistance training. It helps control your blood pressure as well. And yes, your blood pressure does increase with resistance training, but in the end, it can actually help you lower your blood pressure. And we have some limits as to how high we want your blood pressure to go. Usually we don't want it going more than 220 systolic, but it can help control or lower your blood pressure in the end. And it can also help prevent adult onset diabetes, where insulin is used up more readily and sugars are used as a fuel source in resistance training. It'll also improve your self-esteem. You will change your body composition, improve your posture, improves your mood, and improves your quality of life. Now, there are different forms of resistance training. The first one is machines, which are great to start out with to ensure that you're maintaining proper technique and breathing, but eventually I don't like them as they are not really functional. You can use free weights, which can be in the form of dumbbells or barbells. You can use medicine balls. Can also be used as free weights and can be used with resistance training to increase your body weight for some body weight movement exercises. And this is something that you can progress to with your resistance training program. You can do tubing or resistance bands, which are great for at home or even on the road. Body weight, same idea. Many body weight exercises are too difficult to even start out with. So best to start off with the machines. Now, there are different types of resistance training or weight training programs. There is, of course, basic strength. The reason I start off with this basic is that it involves a type of muscular endurance, except we will focus strongly on technique along with breathing to make sure that you are doing it safely and effectively. And then we talk about developing a good foundation with muscular endurance. It is important to develop a good foundation focusing on this aspect for the next, I'd say about 6 to 8 weeks. And then you can start to focus on muscle building if that's your goal, or muscular strength, or even muscular power. And muscular power is a good aspect of, muscular power is a good aspect if you want to focus more on anaerobic sports, or if you're just wanting to improve, for example, your golf game. So muscle building, which is increasing muscular strength and muscular power. Again, great for sporting activities. Now, let's get into the movements. Let's start off by talking about different movements or contractions with resistance training. There are 3 contractions that I'll talk about with resistance training. The first one is concentric contraction. For this example, I'll take a bicep curl. When you bring the weight up, you shorten the bicep muscle. Therefore, if it is shortening while under contraction, and this usually happens when you're working against gravity. The next one is eccentric contraction, and this is happening while you lower the weight or when you are working with gravity. The biceps muscle in this example is now lengthening. Now, if you hold the weight where there is no movement, it is considered an isometric contraction. And this is a type of contraction in which the muscles clamps down on the blood vessels itself. Therefore, we do not recommend this type of contraction as it will put an increased workload on your heart. Yes, there are many fitness gurus saying that isometric contractions are a great way at training muscles. However, there are better ways to train your muscles safely and effectively. So let's talk about the FIT principle for resistance training. That's frequency, intensity, time, and type. So let's go over this in a little bit more detail here. Frequency of your resistance training program should be about 1 to 3 times per body part a week. And basically what happens is there's micro tears that occur to some muscles which need to rest and repair, therefore get stronger and better. So ideally you want to give your muscles about 48 to 72 hours rest in between muscle groups. So you can do your resistance training program twice a week. That would be ideal. 3 times a week if you're training for a specific sport, or once a week is great for maintenance. Rest is so important. Getting your sleep is where the actual adaptations to this exercise occur. Now with intensity, we're going to talk about a couple of things here. How much weight can I push? And to start off, we would like you to gauge an ideal weight in which you can push or pull or lift around 12 to 15 times. First, start off with ensuring that you have the right technique. Then we can get into developing a training effect with focusing on muscular endurance. If the first couple of repetitions are quite easy, then grab a heavier weight. If it is too heavy, then select a lighter weight. Another form we look at is finding a weight that is a percentage of your maximum. Now with muscular endurance, we usually focus on lifting around 40% to 70% of your maximum strength. However, I do not want you to go through all these exercises and determine what your maximum weight you can lift is. That is why as we gauge and estimate. It's very important. So as mentioned, we want to try and get, it is important to get the technique correctly. I can't stress that enough before you ever or even consider raising the weight. Make sure that you're breathing when you're under a concentric contraction and breathing in under an eccentric contraction. I'm going to repeat that. Breathe out when you're under concentric contraction and breathe in when you're under an eccentric contraction. The idea is to lift a weight that is heavy enough to create a muscular fatigue around the 12th to 15 repetition. And then when that gets easy, you can then increase the weight and lift a new weight until you can't do that again, gauging it between that 12 to 15 repetition mark. With the weight you lift, if you cannot lift it 12 times maintaining great form and technique, then it's too heavy. Don't worry, you will be able to eventually achieve this with a training effect, but don't compromise your form for weight. Now, if you can lift the weight quite comfortably where 15 repetitions is actually easy, then it's of course time to increase the weight. And I would probably increase it around 5 to 10 pounds when, like I said, 15 repetitions is easy. You can always do more weight by compromising technique. So don't be one of those people because this will affect your breathing. And because you end up holding your breath, therefore affecting your blood pressure, therefore putting more stress on your heart health. So let's talk about time. How many repetitions should you do? And that's a big key that we like to talk about here. And so with the time factor, how many repetitions we should do, Ideally, I like to see you between, like I said, 12 and 15 repetitions, slowly and controlled. How many sets? Well, for sets, I say one set is fine and ideal. Maybe you should progress to 2 sets, but don't go any more than that. You only want to go to 3 sets if you're training for some type of sport. Otherwise, it's really not worth it. And so 1 to 3 sets, again, 3 sets being very, very high end. I don't do that with many people. It's probably between 1 and 2 sets. How much time between sets? I say that you should rest between 30 seconds to 90 seconds. Always wear your heart rate monitor. If you find that you're going into your target heart rate, walk around for the rest period. Don't just sit down. You'll find too much fluctuation in your blood pressure. So always keep moving a little bit. That's always important. And what timing or cadence should I keep? Now it is important to understand this, and I'm going to get into this 202 talk. And what 202 means is that there's a 2-second concentric movement, a 0-second isometric movement, and a 2-second eccentric movement. This makes for a nice controlled movement with no holes in any of the movements. If you find it difficult to breathe or have difficulty, breathing, then you can have a rest part or easy part of the movement where you can catch your breath. There's always a difficult part of the movement and an easier part of the movement. And if it's the easier part of the movement, that's where you can have a rest breath is what I call it. And we'll go over this more detail in the actual exercises when you're doing that. So the type of exercise is resistance training, and the type is we're going to focus on is muscular endurance. You want to start off with multi-joint exercises. For example, this could be squats or chest press or even rows. This is where you're working more than one muscle group. With single joint exercises, you're only working that one muscle group. For example, a single joint exercise is a bicep curl. You can start off with any type of resistance, machines, weights, form of dumbbells or barbells, medicine balls, tubing, resistance bands, or even just body weight exercises. Ideally, we recommend using starting off with machines and then progressing from there. But ideally, it's best to start off, making sure that you have the proper technique involved in doing the exercises there. So let's quickly talk about what rate pressure product is. And what it is the workload on your heart. So technically, it is the oxygen demand by your heart. How much oxygen is needed for your heart to beat? Specifically, it's your heart rate multiplied by your top number blood pressure, which is your systolic blood pressure, also known as SBP. Ideally, we do not want your rate pressure product going higher. It should be basically similar values to what you're doing when you're doing the aerobic exercise. When you're exercising aerobically, the demand of oxygen in your heart is deemed safe by your exercise prescription. So same thing with your resistance training. We don't want to go any higher than that. You also want to avoid holding your breath, as this can cause an increase in oxygen demand by your heart by increasing your blood pressure and at times your heart rate. So this can cause changes in your blood pressure. So make sure that you're breathing properly throughout the movement. So let's talk a little bit about, just to summarize here, the load or weight you want to use is somewhat hard. It should never feel hard to a point where you need to hold your breath or struggle with the final movements. The repetitions should be 12 to 15 repetitions. Ideally, you want to be less than your aerobic exercise. Remember the exercise target heart rate. So do wear your heart rate monitor when you're doing this. So we want to make sure you're focusing on your target heart rate. And then we want to have some rest periods in there. Like I said, rest periods should be between 30 to 90 seconds between your sets. If you're doing a large muscle group with muscle joint exercises, then you want to rest longer, around 60 to 90 seconds. If you're doing smaller muscle groups like your biceps or triceps, then you want to have shorter rest periods between 30 and 60 seconds. So a big question I get is, why am I sore after resistance training? And this does not happen every time you perform resistance training, but does occur the first few sessions of resistance training. And the reason is that your muscles undergo small tears in the muscles from lifting, pushing, or pulling the weight. And this causes localized swelling and a release of enzymes from your blood that cause this soreness. So this soreness does not last very long. It usually peaks at about 48 hours and then starts to subside. If you have done a chest press or upper body exercise for the first time, you may even think this is angina. And it probably, most likely it isn't, but possibly it could be. And so a great way to check on that is the best way to make sure is if you can reproduce the pain by moving, pushing on your chest, then it possibly is muscle soreness. Stretching can relieve this soreness as well, or even taking a bath can relieve this soreness, but use your judgment going into a hot bath, as it will again dilate your blood vessel. And it is important that you give your muscles ample rest before you perform resistance training of the same muscle group. Aerobic exercises is not the same thing, as you can still keep up with your aerobic exercise routine on a daily basis. So there are some important considerations before commencing a resistance training program. When we talked about resistance training cause an increased workload on your heart, therefore it is important to ensure that you dilate your blood vessels to allow the blood to flow a lot more smoother through your arteries by performing an aerobic warm-up. Hop on your treadmill or bike or aerobic equipment, or even walk outside before you commence your resistance training program. That is why if you're doing resistance training, I recommend doing your aerobic exercise session first, then cool down, then start your resistance training program so your blood vessels are nicely dilated to commence that resistance training program. You want to make sure, I never want to see quick or jerky movements, as this will increase your heart rate. So nor very slow movements, as this of course will increase your blood pressure. So make sure that your movements are well controlled through the concentric and eccentric parts of the movement. I know you see this often, and see people lift weights over the head, and that is fine and dandy if you're not at risk. But if you are at risk, meaning if you have heart disease, diabetes, or high blood pressure, do not lift anything above your head. And the reason for this is because your heart has to pump against gravity, therefore increasing your workload on your heart, therefore raising the oxygen demand on your heart. So make sure you're not lifting anything over your head. Very important thing. I've said this many times during this talk, and it's very important to make sure that you're not holding your breath. You should make sure that you should breathe. Make sure that ideally you want to breathe in, exhale on the hardest part of the movement and inhale on the easiest part of the movement. So in the contraction phase, you should be breathing out. In the relaxation phase, you should be breathing in when the muscles are lengthening. And you want to breathe in when you are working with gravity, or the easier part of the movement. And this is again the eccentric part of the movement. So at the end of your exercises, your resistance training program, when you're finished your resistance training program, you want to aerobically cool down. Walk on your treadmill or go on your bike. And we talked about the oxygen demand on your heart. So it's important to bring your heart rate and blood pressure down after your resistance training program. So it's very important to have those aspects in there. So again, follow this recommendations before you start your resistance training program. And again, you can download the resistance training program on your CD side. And so here's to your success in completing your resistance training program.